This is Julia Brown reporting on Sherrod Tucker, who's a 7-year-old African-American male that came into the office today with wheezing and rash. The wheezing started yesterday, and he's also had a dry cough with high-pitched sounds. The cough is aggravated when he plays outside and actually is relieved when he comes inside and rests. The cough is worse at night and has been so bad today that he had to come inside from recess. As far as the rash, he's had that for about a month now, and it's just red and itchy. Patient's past medical history: he has been diagnosed with sickle cell disease. He's had some allergic rhinitis, 8 hospitalizations for sickle cell crisis, and the last one was about 8 months ago for pain. Parents are divorced, and he has had a splenectomy at the age of 5. Backtracking a little bit there. He is allergic to codeine, and I'm not sure the reaction. Mom did not clarify in the office today. He is currently taking penicillin V 250 milligrams BID, Zyrtec 5 milliliters QHS. He's up to date with all of his immunizations, except he is due for a DTaP booster. He's been getting routine CBCs at the sickle cell clinic about every 4 to 6 months. Last LFTs in UA was about a year ago, and his last PPD was about a year ago and was negative as well. Pain today, he is scoring a 3 out of 5 on the FACES pain scale. Review of systems, he has been in pain most days. Skin rash all over the body, as we mentioned earlier. Eyes are red and itchy as well. He has had some sneezing, some rhinorrhea, and Mom reports that he does get colds often. Cardiac Mom does report that he has a heart murmur and has had that all of his life, but she does deny any heart defects. Other than that, the review of systems has been negative. Physical exam, vital signs today: weight 17.5 kilograms, falling right below the 5th percentile. Length 113 centimeters, falling within the 5th percentile. Heart rate is 120, respiratory rate 42, blood pressure 92/55, temperature today 99.5, and oxygen saturations are at 89%. He's a very ill-appearing child. The skin, there is some hypopigmented areas noted. It is warm, rough, and dry, with red raised rashes on the arms and legs. He is, with his face and nose, there are some boggy nasal turbinates with pale edematous nasal mucosa and clear rhinorrhea. Conjunctiva is mildly red and injected. Cobblestoning appearance to the conjunctiva as well. Respiratory, he is demonstrating subcostal retractions with nasal flaring and grunting, and has diminished breath sounds. No wheezing is noted on exam today. Otherwise, physical exam everything else is falling within normal limits. Assessment today: acute respiratory distress syndrome with concern for acute chest syndrome, sickle cell disease, atopic dermatitis, allergic rhinitis. Medications, I'm going to go ahead and give him albuterol treatment in the office today. I'm going to start some OT via non-rebreather mask to make sure we keep his oxygen saturations above 93%. I'm going to also continue his current medications, the penicillin V 250 milligrams POBID, because that is suggested with the sickle cell, and especially since he's had his spleen removed, we will continue that throughout. Zyrtec 5 milligrams POQHS, we're going to continue that, and maybe discuss in the future the need to change this medication up if he's not getting the relief that he needs from that. As far as diagnostics today, he needs an ABG, whether we do that here in the office or stat once he arrives to the emergency room. And he will also need a CBC with diff, Retic, platelet count, BMP, and a stat chest x-ray upon arrival to the hospital. So therefore, we are referring him immediately to the hospital to get these labs and tests run to see if we can go ahead and confirm a diagnosis for Mom. she's very concerned today, as she should be, and so we're going to go ahead and refer him out and get him some treatment to get him stabilized. With his other diagnosis, upon discharge from the hospital and follow-up at the office, we will discuss the atopic dermatitis, which we're going to treat conservatively with treatment and education, avoiding skin irritants such as harsh soaps, shampoo, perfume, creams, and lotions. Tell mom, do soft clothing, nothing rough on the skin, and minimize bathing to about every other day. The goal here is just to restore the moisture in the skin, and that can be done by lubricating at least twice daily with non-perfumed creams and lotions. After taking a bath, I will advise them to just pat the skin dry and then apply the lubricant when skin is still moist with a little water on it. Also, I will have mom to maybe purchase a humidifier, which is often helpful to keep moisture in the air. And then if these measures don't help, we will reassess the patient and then maybe consider adding some mild systemic or topical corticosteroids. His allergic rhinitis, as I mentioned before, he is on the Zyrtec, but apparently that is not taking care of it and treating his symptoms. So we might consider switching that up, maybe to some Claritin or adding an intranasal corticosteroid such as Nasonex, and we will discuss that with mom as well. He is also want to discuss vaccinations because it's important that he gets these every year as well. The flu vaccine, and currently he is up to date, but he is, like I said earlier, missing his booster DTaP, and we will get that as soon as we can. Before they left the office today, I did just discuss hospital procedures and kind of what to expect once they get to the hospital. Even though he has been admitted before, it still can be a very scary and stressful time for the child as well as the mother. So we just want to make sure that everyone is comfortable in that situation. And I try to educate the best I could to the action plan and what might be taking place once they get there. So we will follow up with this child upon discharge from the hospital and then proceed with the other diagnosis as mentioned previously.